Welcome to Module 10 of the IDVA's PI Education Program. Tonight we're going to be talking about family and relationships. For those who are not aware of IDFA, we are a not-for-profit organisation who represents people with primary and secondary immunodeficiencies nationally. Our key priorities are education, awareness and advocacy. I think tonight's topic will be of interest to many people, and I'd like to introduce our speaker, Louise Healy, who works for Rare Voices Australia, of whom we are a partner organisation. Louise is a parent who has a child with a rare disease and works in the education and advocacy space in her day job. So she's very well qualified to talk to us about family and relationships. So tonight we're going to talk about strategies to deal with PI within the family. When one or more member of the family live with a rare disease, it has an impact on our relationships and on the whole family dynamics. In this webinar, Louise will address some common issues and suggest some practical ways for the whole family to communicate more effectively, as well as to develop some coping strategies. If during the course of the webinar you do have questions, could I ask you to pop those in the Q&A, and at the end of the webinar I will come back and Louise and I'll do a Q&A format to answer those questions for you. So I'd like to now hand over to Louise Healy.
Thank you. Thanks very much, Caroline, for having me and inviting me here. I'm really excited to be here. I'm just going to start sharing my screen first. Sorry, it's just taking a bit of a moment to there it is. Okay, so thank you for that introduction, Caroline. Yes, today I'm going to talk about families and relationships. I'll just say a little bit about what Rare Voices Australia is first. So we're the peak national body progressing policy and system change to benefit Australians living with a rare disease. And as part of that, we led the collaborative development of the National Strategic Action Plan for Rare Diseases. Our focus and expertise is on policy and system change to address challenges faced by the rare disease community. And we work in partnership with 90 rare disease organisations, researchers, clinicians, government and industry. People, obviously people like IDFA, we work with regularly. So that's just a little bit about what we are. About tonight's presentation. So tonight I'm going to talk just a little bit, I guess, to give you some research to help you understand the context of some of the suggestions that I'll make. But as Carolyn said, you know, my background is as a rare disease parent. I have postgraduate qualifications in psychology, and I work in the corporate sector as well as in the not-for-profit sector, you know, providing tips around people and relationships. So what we're going to talk about is tools for managing stress, strengthening family and other relationships, fostering independence and positive self-management, and managing transition. And when you see what the research says, I think it'll make it clear why these are the areas that I've focused on, but I'm happy to take questions about that. So if you are happy to, I'd love to just get a bit of a sense from people who've come along about what's important to you or what you'd like to get from today's session. So if you just wanted to put a few notes in the chat box about, you know, about what you're hoping to get from today's session. I do apologise for my noisy dog and family. Joys of working from home. So yeah, if you have a moment, just pop it in there and I'll try and sort of target some of my responses to what you're asking, the questions that you're asking. Okay, so a little bit to get some context. So relationships are fundamental, and there's quite a bit of research now that's telling us some really important things about human beings and how social we are. So I think, you know, a lot of models of organisations, of care, of clinical care, of interaction are often based on the notion of independent, rational, consistent human being who makes decisions based on external information. But what the science tells us really is that we are fundamentally social. And what that means for us as rare disease family members is that connection, support, being seen, heard and valued, working as a team, that's something that we derive sustenance and strength from, which you can see there from the Brené Brown quote, that it is something that gives us sustenance and strength. And I think throughout the research, you'll see how important those relationships are. So what does the research say about children relationships and chronic conditions? So I'll try not to read through all of this, but I think the high level summary is that firstly, that children do adjust pretty well generally to a chronic condition diagnosis, that the default position of most children is actually to adjust pretty well and spontaneously use lots of coping strategies without needing to be told and taught them. And that in that way, they're similar to their peers. The types of strategies that they use are very, very similar. And I think as a rare disease parent, I feel like I have seen that in action. There is, however, a correlation between parental adjustment to diagnosis and the child's adjustment. So this is an important thing for people who've come as parents of somebody with a rare condition, is that the way that we adjust to it is pretty important. And I'll talk about some tools to assist you with that and a little bit about my own experience. Children with a chronic condition might be more sensitive to parental stress and anxiety, and this has an impact on them. And I think the last two bits are about supporting kids from a very early age to learn self-management and self-care, and to foster and be a facilitator of their children's becoming an expert in their own condition and care. And it's something I try to practice in my own life, but there are some barriers that we might come across, and we'll talk about those a bit later as well. So what about adolescence? So if you're in that adolescent phase, so my daughter, I'm calling her a child, but she's 13 and she'd be horrified to think that's what I'm saying. She is actually an adolescent, and it brings its own set of challenges when you have a child with a chronic condition. So the first thing is that increasingly they want their own voice to be heard, and more privacy and confidentiality in healthcare situations. So as is a normal part of adolescent development, where they do pull away from the family and seek other sources of support and engagement and connection, they also seek to have more autonomy and their own identity separate from the parent. And I think as parents that sometimes can be a little bit confronting, especially when we've been so, particularly if you have a child diagnosed very young. So my child was diagnosed by newborn screening, so I've been in this from day dot. When they start to sort of pull away from your management and insight and help and all of the learning you've had, that can be quite challenging. But promoting self-management turns out to be a really good strategy in terms of well-being, determination, strength and participation in healthcare. And it seems that the more that the individual is able to participate and control it themselves, the better the outcomes are. The other thing that's really important that I want you to take note of is that peer support really seems to provide a positive relationship and support them in improvements in well-being and behaviour. So this piece of research was quite interesting because it does support improved behaviour and emotional well-being. It doesn't actually improve physical well-being and health outcomes the same way that family support does. So although peer support is really important, it has some limitations, or the research has identified some limitations. So good motivation, a strong sense of normality, a positive attitude towards treatment, support from parents, nurses and physicians, and a feeling that the disease, I think this is so important for adolescents, was not a threat to social well-being, were predictors of positive outcomes for adolescents. I'm really aware that can be hard to achieve with a teenager, but it does tell us some of the things that we can focus on to help us help our teams through the period, and also to prepare them for transition. Okay, so what about adults? So is it just as important for adults in terms of their relationships? The answer is yes. So family cohesion, attentive responses, and what was the self-reliance are all associated with better patient outcomes, whereas critical, overprotective, controlling or distracting family responses were associated with negative outcomes. And that's across the age groups. So I think that's a really useful thing to remember, and that shift where with a child we might try to be more encouraging and motivating, whereas maybe with adults we forget that adults need that too. Close and supportive relationships with families, friends, spouses and children leads to a high level of well-being in adults with chronic illnesses, and that well-being seemed to be across the board, so all aspects of well-being, including physical as well as psychosocial. And the final thing, which I really like, because I think it really aligns with my own thoughts and my own experience as a rare disease family member, is when adults with a serious chronic illness perceives that it is a shared rather than an individual problem, so either their spouse, their partner or other family members are part of their team and are collaborating with them to manage the condition or support them, then this also promotes better outcomes. So I just wanted to sort of present that research because I think it really highlights that families and relationships are so important to getting good outcomes for people with chronic conditions. So family influence is critical at all stages. Families can be a positive influence on effective management of chronic illnesses. And the summary, I guess, of this is positive and supportive family and peer relationships are really an essential part of managing a serious chronic illness. Fostering and supporting independence helps individuals with rare, serious and chronic conditions. Critical and controlling approaches, as well as poor family cohesion, have a negative impact on the well-being of people living with a serious chronic condition. So these are the things that I could take away, but the feeling that the challenge is shared and that family members are part of the team is also important. And I think that's what the research tells us. So I guess the rest of the presentation, what I'm going to talk about tonight is, well, how can you achieve that? What are some of the things that you can actually do to support and cultivate this approach? Okay, so the first thing, and this is whether you're a parent, a person with a condition, a sibling, a partner, a spouse, whatever your relationship is with the immune deficiency, the first thing that you always do, and this is for everyone in every situation, is manage your own responses first. So it's very, very hard to support someone if you're not managing your own responses. And so there are three parts of this. There's stress, there's anxiety, and there's busyness. And these are all things I'm sure that we can all relate that impact on our ability to fully support the people in our lives, whether that's, a child or a partner, or whether we're the person with the chronic illness and, we're seeing that our illness is difficult for family members and we want to provide them with support. So number one up here is self-compassion. And I put this up here because I think this is actually a really hard thing to do. I think most people are really, really hard on themselves, quite judgmental of themselves. And I often will say in the coaching work that I do, would you say that to your best friend, what you're just saying to yourself, how you're thinking about or approaching yourself? Is that what you'd say to your best friend if they'd made a mistake, or your child if they'd made a mistake? Yet with ourselves, often we don't have that same tolerance and compassion. And I think it's a huge part of managing stress and anxiety. I think there's a lot of pressure on family members when when there's a family member with a rare condition, particularly one that needs complex management and complex daily management. And I think back to my early years, and this was a huge lesson for me, that I put a lot of pressure on myself. I was constantly anxious that I was going to do something wrong and make a mistake in the treatment and cause a terrible outcome. And that anxiety didn't help me actually to manage it any more effectively. In fact, it made it worse. And it also, I guess, wasn't helpful to cultivating that sense of normalcy, which I think is really has been an important part for my daughter, is that normalizing to make the condition a part of her life, but not her whole life, to make sure we focus on the other things that are part of her life. So the self-compassion really helped me to put the condition of where it belonged in our family, which is it's something that we need to deal with. It's not, it is what it is, but it's not our whole life and it's not our whole family, and there are plenty of other things that we can focus on. I really encourage people in this situation to have proactive stress management strategies. So this is about thinking about yourself as an individual and what works for you, and it can be quite different for different people. Is it mindfulness practices and meditation, which is my preferred one, and that is also supported by quite a lot of research around mindfulness-based stress reduction, but also mindfulness for people who actually have a chronic condition. There's quite a lot of evidence showing that it's a good way to manage pain and other symptoms associated with having a condition. So that it could be a mindfulness practice, it can be exercise, it can be self-care activities. Spending time in nature has been shown to have a really positive effect on people's mental well-being and stress levels and reducing that. Spending time with pets is the same. So really this is about you thinking about what actually helps me to manage my stress, and not falling into the biggest trap that I think most people have, which is dropping the practices that help us most when we get busy. So when the pressure is on, this is a really common experience that I see all the time. The pressure goes on and people stop doing the things that were helping them, whether that's they stop going to the gym every day, or they stop meditating every day, or they stop taking the time to go outside. And I actually thought about this yesterday because we're homeschooling at the moment, which is another joyful pressure on a family with lots on. And I've been really busy at work, and I suddenly realized that me and the children had actually not left the house since lockdown was announced on Saturday afternoon. And so I rounded them up with great protest and got them outside, walking with our masks on down by the brook. And what I found is, you know, a marked shift in everybody's mood and how they felt. So, you know, it just sometimes you feel like you don't have time, but you actually have to make time for those things. The next thing is to cultivate social support and connections. I think it is clear from the research that peer networks are really important for people with chronic conditions, so for the people who actually have the condition. But I think my experience is actually it's also helpful for the family members of the person with the chronic condition to have that kind of peer support. So reach out to those peer support networks, but also just strong social supports. The research tells us are very protective against depression and anxiety. So people who have a good friendship group that they can turn to and they can rely on seem to be quite protected from a range of mood disorders, particularly depression. The other thing that was clear in some of the research, I didn't talk about it a lot, but also is using those connections and those social networks to get practical support. Very often, and I know you all know this, that with a rare disease, there's lots and lots of burden on time in terms of care for that person, or looking after treatment regimes, or going to appointments. And I think sometimes it's that practical support you might need to reach out to. Some really good research on resilience, on people who are resilient. One of the things that resilient people are good at seems a bit counterintuitive, but what they're good at is asking for help when they need it. Resilient people are much better at putting their hand up and saying, I'm not coping. And people who are not resilient are reluctant to do that. So I think it sounds counterintuitive, but when you really think about it, it makes sense to me. If I am self-confident enough to say, I'm not coping at the moment, can you give me a hand? That probably helps me to bounce back quicker. And obviously, finally, to seek professional support when needed. And I've just put the headtohealth.gov.au site there. That's a fantastic resource for people who feel that they might need some professional mental health support. And one of the things I would say to that is I think this is a really hard one, particularly if you're a person caring for somebody with a serious condition, to recognise in yourself if that's what you need. And I liken it to what most marriage counsellors say about marriage counselling, is that so many couples get there in crisis, and that the counsellor would have been able to do more or be more effective if they were able to intervene before it was a crisis. And I sort of encourage you to think the same way about yourself and your own needs, and not wait till you're in crisis. If you feel like you need a little bit of extra help, then reach out and get it. So the first thing is to really look after yourself and your own mental well-being, because that will help you look after the other people in your family. And it also is the foundation for being able to build those really strong relationships and those cohesive, supportive relationships that we see are so beneficial to a person who's living with a rare or serious chronic condition. Second thing is to build family cohesion, but to strengthen all types of relationships. So to use some strategies to really, what came through again and again in all of the literature that I read, and the literature that's out on this, is that family cohesion is a hugely important part of that person's management of their condition. It has a huge impact. So what are some things that we can do to strengthen relationships? First, we manage our stress, and second, there's 3 techniques that I'm going to give you. And the first one is to give people full attention. So this sounds like, oh yeah, that's right, I do that. But I want to ask you, and I want you to think about how often you kind of zone out when your loved ones are speaking to you, sort of listen with half an ear and think about something else, or focus on cooking the dinner, or the next thing you have to do in your list of jobs to do, or the next appointment you've got. I mean, I can think about this, how often I get in the car with my kids, and I've really realised that that's actually a precious time, because it's a time somehow, particularly with little boys, where they tell you things because they're not looking at you that you mightn't otherwise hear. And I've really learned that often I'm not fully attentive, and when I do pay attention, I hear really gems that help me in building that relationship with my kids. And I want you to just think how often you are giving people that really full attention, not with your mind divided, not with your busy mind, not rushing about, but stopping and letting that person be seen and recognised and valued. This one requires quite a bit of discipline and attention and focus to do, but I really encourage you to try and do that. There's a great saying that from Stephen Covey, who wrote that book called The 7 Habits of Highly Effective People. And there's a bit of a gem in that one, which is that most people don't listen with the intent to understand, they listen with the intent to respond. And when we give full attention to our loved ones, we're listening with the intent to understand, not the intent to respond. So even just checking your intent and thinking about, could I really improve my listening and attention and focus on the people who are really important to me. And I do sometimes think, if I'm in a coaching session with a client, if I'm presenting to people, if I'm at work, I make a lot of effort to be really present and pay attention. And sometimes I come home and feel tired, and I don't actually give the people who mean the most to me the same respect and courtesy and effort. And I have to remind myself to do that. And I guess this is a call to remind you to do it. The next one is called the 5-to-1 ratio, and this comes from a researcher called John Gottman, who researches primarily romantic relationships, but has sort of expanded that out. And some of his findings seem very applicable to all kinds of relationships. And one of them is that people who have the most successful relationships have a ratio of 5 positive comments to every negative comment they make, or critical comment or judgmental comment. So I guess just take a moment now and think about, what's my ratio look like? Is it a pretty good ratio? am I getting it right, or could I shift that up? And the reasoning behind this 5-to-1 ratio is that those positive comments that you make, those nurturing comments, those offering praise, offering affection, offering acknowledgement, commenting on something well done, saying thank you, whatever it is, they build up what's called an emotional bank. And so that emotional bank is there. And I guess then the idea is that when you need to draw on it, you need to raise something or share something that you're upset about, or bring up a contentious argument, you've actually got an emotional bank to draw on. So those 5-to-1 positive to negative ratio is, I think, a very important strategy, and it's a simple strategy that anyone can use straight away to really improve any kind of relationship that they want to improve. And when I do bring this to mind and do it, I recognize that we're habitual problem solvers, and so it's often easier to notice and comment on what's not going well, what's not being done, what you're not happy with, than it is to notice and comment on the things that are amazing. And once again, I feel that this one sounds simple in practice, but requires you to give some time and attention to actually doing it. But it's an offering to challenge you to do that. And the final thing is to focus on people's strengths. So there's quite a huge body of strengths research that says when you focus on what people are good at and encourage them to work in the space of what they are good at and what their strengths are, they're happier, they're more productive, they have a high level of life satisfaction, they're usually more motivated. And yet again, I think culturally we're often, I guess, drawn to talk about what people are not good at rather than what they are good at. And I think, when you go to a parent-teacher interview, when you do a performance appraisal, when you get feedback from someone, often the positive bits are pretty cursory, and the things you need to improve get a lot of attention. And the idea of strengths is you actually flip that over and spend a lot more time on strengths than you do on what people are not good at. And I want to share a little story about this in relation to managing a chronic condition, because one of the things I think that also is clear, and I hope was clear in the research I presented, is that fostering independence and self-management and fostering it early is actually a very beneficial thing to do. It is hard to do, and I'll talk about why it might be hard later. But one of the things is my little person was born to be independent, I would say. So she walked early, she talked early, she just was born to be independent. And that has actually, by focusing on that as a strength, and she's a little bit competitive too, that has allowed me to, I guess, push some more independence onto her when she might have been reluctant to do it. So for her to take ownership of things like doing her weekly testing and herself, which is a blood test which she's been doing since she was 5, and trying to do some of the tracking around her treatment and that sort of thing herself. I mean, that's still a work in process because it's quite complex. But what I noticed about her is both that she was sort of naturally inclined to be independent, and she was also naturally inclined to be competitive, and both of those things have helped in me positioning maybe some of the things that I wanted her to take on from me. And look, as I say, it's a work in progress, and I'll talk about some of the barriers that we've hit as well as we talk more. But that's 3 strategies. And I just personally like in this world the notion of focusing more on what people are than on what they aren't. And I think it really is a great tool to cultivate a positive connection, and that sense that Brene Brown spoke about in the first quote that I put up, of feeling valued, seen and appreciated. And we know all of those things are really predictors of having excellent relationships. Okay, so the next thing is obvious, which is to nurture that positive self-management. So this self-management over and over and over again came up as a really important part of effective management of a rare condition, of a chronic condition. And there were a number of elements to that. So the first one was about education and knowledge, about getting people to be quite informed about their condition. And that's a job between the family members and the clinical team. So that's a shared role. And also, it's also the role of peer support groups or support groups like IDFA, where you can access useful information and find out as much as possible about the condition. So having a really well-informed person, I think, is really useful. And that can be informed about the condition, but I also think increasingly it's about being informed about the health system and what roles, rights patients have in the health system. I think the other bit about the education is one of the other predictors. I didn't talk a lot about it because it's a bit of a different kind of a relationship, but one other predictor of a good outcome for somebody with a serious chronic disease is a positive relationship with the prescriber or clinician. And I think this is often tricky for rare disease families, because often there's only one choice. If you're not agreeing with the approach of your clinical team, or there's a personality clash or something's going on and you're unhappy, there's often nowhere else to go because there's only one specialist in your area who deals with the particular condition. So I think one of the other bits of education that I would encourage you to focus on is education around effective self-advocacy, or effective, standing up for yourself, and how you do it in a way that upholds the relationships and supports effective relationships with a clinician, so that that person feels not only empowered about that condition, but empowered in how they deal with the health system, which I think we all know can be quite tricky to navigate at times. The second thing is to recognise the barriers to building independence. And when we get to the Q&A, I'm happy to hear people's comments about what they think some of the barriers are. But I think some of the barriers for me are two-sided. So on the one side, as a caregiver, now this is probably particularly a parental one, but I think it probably applies to caregivers who are spouses and that sort of thing. One of the barriers I perceive is that letting go of control is scary. And I think it's been very scary for me. My child's condition requires pretty intensive daily dietary management, as well as multiple medications every single day, and with pretty serious consequences for not adhering to the treatment. There are very serious long-term consequences for not adhering to the treatment, but very little biofeedback immediately to say don't do that anymore, or get back on your treatment. So letting go of control to a teenager who just wants to do what everyone else is doing and just wants to fit in and just wants to be normal, and all of those normal teenage things, has been really difficult. Letting her not do some of the things that I think she should be doing, and then answering to her clinical team about why they're not being done instead of me being involved in it and being part of it, has been very challenging. So one barrier to independence is, as if we're a caregiver, our own fears and concerns about handing over control, about whether or not we can trust that person, about when we should do it, and making those judgments. And I think one of the questions I'll often get asked about this is, well, when is it? And I don't know when it is. It's when your child is ready. But I think one of the things, if you're a caregiver and you recognise this, that you do need to do is test yourself to say, is it me that's not ready, or them that's not ready? And I also think sometimes we need to push people a little tiny bit before they're ready. So, they may be resistant as well. So that's another barrier to building that independence, is that sometimes the person doesn't feel confident enough or ready enough, or the burden is heavy and complex, and it's easier and more comfortable for them to let somebody else be in charge. And there's certainly a couple of things with my child that she, I think, would let me just keep on doing forever if I was willing to do it. and would probably make me more comfortable if I could do it. But we're in that little bit of pushing and that kind of balance between building up her confidence and her sense of capability in doing it and her determination to do it. And that's where I'll draw on those strengths around her natural independence, her natural competitiveness, to kind of get her engaged with taking a lead role, and shifting the role from me leading it to her leading it and me supporting it. So that's a barrier to independence. Other barriers can be that the person, is actually not well enough sometimes to take on as much self-management as would be ideal. And again, you have to manage that and keep checking with yourself. Is now the time? If you're a person who is wanting more independence or more self-management and to engage with that, then that's a conversation I really encourage you to have with the people around you about what you need from them to get that happening, and to also rely on your clinical team. Now, a way to manage these I guess barriers is to set some goals. And I think one of the things I really encourage families to do is also to surface what the worries and concerns are. Like, why am I worried? What is it that's worrying me? And in our community, one of the worries is that when you've been caring for this very complex condition since your child was a tiny baby, and suddenly the clinic says, oh, actually, you don't need to come to this appointment, or could you not be in the room for this next bit of the appointment? It's a bit confronting. And I often say to our clinical team, transitions for the parents as much as it is for the kids. So don't forget that the parents need to be transitioned too, because we do, and we'll talk about that some more. But I think one of the things that helps is setting some goals. So what is it that I'm going to take on in my self-management? What does it look like? What support do I need? What's the time frame? What are the fears or worries about doing it? And what can we put in place to try and trying to address those fears and worries? The team approach, and I think this is that research about the adults, but I feel it when I go to my clinic, and it's one of the things I think my particular clinic is excellent, is that I feel that we're all part of a team working together. And I think when you think about this is a team approach, so there is the person in the lead, which the leader ideally will be the person when they're ready who has the condition, but the rest of us are on the team and we have a role on that team. And again, talking about that and being part of it. And that's the bit that makes the person feel like it's not an individual problem, it is a shared problem. And it's something that the family can do together and support them with. And, in our house, in fact, the team approach I've found, particularly for adolescents, this is my experience with my own child, is that some of her friends are part of our team as well. So they know what her condition is, they know what needs to happen, they know what she can and can't do, and they're pretty good at holding her accountable in a way that is supportive and caring, and that she recognises is people trying to do their best for her and support her. So the team can be broader than the family, and if there are peers who can be involved, I think that's really, really helpful, because I think it's that network of support around the people that help. And finally, part of your team can be this peer support, and this is why organisations such as IDFA is so important, because it's a way for you to get peer support. I think one of the things that it sometimes can also be a barrier in this self-management is the people who don't have the condition. Yet, yes, we live with it day to day, but living with it as a carer and a family member is actually not the same as having it. And one of the fundraisers we do in our patient group is a fundraiser where we actually follow the treatment that our family member is on for 24 hours. And I did it, and it really hit me very hard how much I think that I understand the condition, because I've been managing it and caring for someone with it for 13 years now, but it is actually totally different to living with it. And so I think peer support is so important. It's important for me as a parent to share my experiences with other parents who are having the same experience, but it's also important that the person with the condition can get support and access support from people who are also having similar or same experiences as them. So nurturing positive self-management is my next tip. So the final tip is to prepare for transition. So there are many transitions for rare chronic disease families. The one that we most commonly think of is that transition from paediatric to adult services. But I think there are lots of transitions that we face in our lives. It can be a transition from when a child starts school, or when your family member has their first job, or when they finish their job, or when they're in employment. I'm going to talk around the specific transition from a paediatric to an adult service. But I want you to, I guess, as I do, keep in mind that there are all kinds of transitions, and that a lot of these tips are relevant to that. The reason I am focusing on it is that the research does show that transition from paediatric to adult care can be quite challenging for everyone, for the family as well as the person, and that it's often a time when we would see adherence to treatment and positive outcomes or health outcomes not be as good as they could be, and that can take quite a lot of time to recover. So the more prepared people are for that transition, the better it is. Many of the tertiary state-based hospitals, big hospitals, have excellent transition programs, and there are some great resources, including from the RCH, that you can use to think about those things. But I want you to think there are lots of transitions for us, and I feel like I've had so many already. So hopefully when I come to this big one in the next couple of years, I'll be very, very prepared. So the first tip is, if you are preparing for a transition, share your worries and concerns. And that's a little bit like the self-management one that we had previously. I think in the context of that clinical transition, sharing your worries and concerns with the clinical team is quite important. I have seen families a little bit blindsided because they didn't realise that how early transition activities might start, or discussions that they weren't aware that the clinic was going to have with their family member happening, and they're not feeling comfortable with it and wanting to have pre-warning. So I think if you have any worries and concerns, you talk to each other about them, but you also involve your clinic in just asking what's going to happen. And in our particular clinical setting, and it's not in everyone, but effectively, really, once the child starts high school, the clinic begins to do things that are definitely preparing them for that transition. So caregiver worries can sometimes impede the transition, and I think in particular, we saw that research earlier that said that adolescents want a sense of having their own voice. They start to have that really strongly, and that some of that is about privacy and confidentiality, and the potential that you as the caregiver mightn't be involved in every conversation they have about their health, and that can be confronting. So just be ready for that and think about that. Transitions start well in advance of the actual event. So the best kind of transitions, I guess I think now that the ideal thing is from day one, that you're day one of diagnosis, or really when you get your head around a diagnosis, that's when you start thinking about the long term. I mean, I wish I'd done that in day one. I didn't. It took me about 5 or 6 months to get my head around the diagnosis and what it meant for us and a family and what we're doing. But once I did start to think about, how do I want to set up my child for the long term? What are the things that will be important? And they did come to preparing them for independence, normalising the condition as much as possible, having a place for it in our family where it's acknowledged and recognised, and that we don't pretend it's not difficult, because it really is sometimes, but where it is a part of our lives but not the whole of our lives. And it did mean things like adjusting some of our family celebrations to account for her condition, and having different emphasis on things that maybe that we would have previously. It has meant planning our family holidays in a different way, but it hasn't meant that we didn't do those. It just, and one of the things that's really occurred to me 13 years down the track is that some of the changes we've made have been positive for everyone, not just for her. And so I think that, it's one of those ones where out of something that's and is and remains quite difficult at times, some really good things have happened. And the other really good things that have happened in terms of relationships, and those are in the peer support network for both herself and for the rest of the family. And I guess the final thing I would say about that is that, for the rest of the family, that also means siblings, and involving siblings in peer support, I think is I think it's really, really useful, because they feel part of the team when you do that as well, and engaging a sibling as part of the team is really useful. So they are my 4 tips, which are to manage your own stress and anxiety, to build family cohesion, to foster and encourage self-management at whatever stage you're at, and to prepare for the transitions that you're going to face as a rare disease family with a serious chronic illness. And I hope they're very useful. And what are your questions? Has anyone got any questions for me?
Thank you. Thank you so much, Louise, for that presentation. And there are a couple of questions, but before I go there, I think that you really gave all of us some fantastic strategies around dealing with relationships. And thank you for being vulnerable and sharing the challenges that you've perhaps faced in the last 13 years with your child and with your family, because regardless of whether there's a chronic illness in a family or not, we all face those challenges, and we all face those relationship difficulties. So thank you so much for sharing. So the question that I have in front of me now is, what are your tips for those who are diagnosed later, like my son, who found out that he had CVID at the age of 22? Since then, he has developed a number of conditions that he's had to manage, and it's been really difficult at his age to realise that he's got a lifelong disease without a cure, which affects his quality of life.
Yeah, look, I think it's really hard, and I think this is, I flagged early about managing your own stress and anxiety, and I think that's really important for people who do have a later diagnosis, that's something they do. I would always encourage people to seek professional help in that case, because it's a huge thing. And I think, somebody asked me once, I was talking to health professionals about managing the diagnosis process and supporting families, and one of the things that I said, and I don't think I'd really realised how true it was, there is a grief associated with diagnosis, and it is grief. I think it's real and genuine grief, and I think acknowledging that some of what he's experiencing is grief, and the grief is for what you imagine things are going to be. And it probably took me quite a lot of time to realize that that's what I'd experienced when I got my child's diagnosis, was actual grief, because she is actually well. She's got a condition that can be managed, and the outcome when you manage it, without saying the management is difficult, but the outcome is really, really good. So I think I felt that I wasn't entitled to that grief or something. And I think, it's actually just letting people know to normalise those feelings, whether that's anger or sadness or whatever it is. So number 1 is to normalise it. And number 2 is to encourage them to get peer support, which we know really helps. So one of the reasons that peer support helps is because people have a shared experience that they can talk to and they can talk about. And as much as maybe a parent or a you want to be the support. Sometimes they need support from people who've lived through it. So I think encourage them to peer support, and then also encouraging them to get professional help, and reminding them that you don't need to be in crisis to get that help. It might just be a couple of sessions with a counsellor or psychologist to help you process the experience of what you're going through. So there's some of my tips that I would encourage. And then just that sense that he is not alone in it, that he's got you and the rest of the family as part of his team. So that, I think the thing that struck me in the adult research is that one of the things that really helps adults is feeling that they're not in it alone, and that it's a shared problem and challenge for the whole family. So that's my response to that question.
Yeah, thank you so much for that. And the next question, first of all, says, thank you for sharing your story. But do you have any advice for how to educate extended family members to help them understand the daily reality for managing chronic health conditions?
Yeah, I do, but disclaimer, I probably haven't been great at it myself. I think, one of the dangers is that you do just put your head down and deal with it, that, you've got it so much on your plate in dealing with it, and that you kind of forget that it's useful to have your support network. So I sort of realised this at some time. I think I was starting to travel quite a lot for work, and I actually realised it was a huge problem that without me, nobody really knew what I did day to day to manage my daughter's condition. So what I did is I wrote a manual. So I kind of wrote a manual that outlined what I was doing each day and had checklists and that sort of thing. And it's been really useful because it's also been a tool that I've been able to use with her in terms of fostering her independence and showing her how I plan for things and how I plan around holidays or outings or those sorts of things. So I think asking people to, I think this is one of the things I talk about sometimes. There's barriers. One of the barriers for me was asking people to make adjustments for our family at family events. But I would encourage you to do that sooner rather than later. This is what we need. This is what would help us. This is what you could do to make this family event easier for us as a rare disease family.
Thank you, Louise. And I'd just like to say to our audience, I've just launched some polling questions about the webinar tonight just to get your feedback. So if you wouldn't mind answering those couple of questions in the next few minutes, that would really help us. So before we finish up for tonight, I just really like to say thank you to Louise for sharing your story and for giving us some amazing tips about families and relationships in relation to chronic disease. But I think in relation to sort of general relationships about looking after ourselves and caring for those around us, and particularly in current times, we can't ignore COVID. Many of us are in restrictions now, and that creates another level of stress, let alone people who are living with family members with chronic disease. So thank you so much, Louise, for your presentation. Thank you to our audience for attending tonight. And I'd just like to remind you that next week, we've got Module 11, which is around the financial burden of PI. So if you're interested in hearing some tips around that issue, please register. We will send out a recording of tonight's webinar, as well as a link to the registration for next week. So again, thank you so much, Louise, and thank you to everyone who's participated tonight, and have a lovely evening.
Thanks, everyone. Good night.
Good night.